Well, thank you for having me here with you guys. It's a pleasure to be in Romania. It's a pleasure to teach chemical peels. I hope we're going to do something really good today that will benefit your clinics afterwards, that you can really use, not just a lecture where I talk, you listen, write few words, you go home, never again. I hope we'll move a border and then I will teach you something that you can really use in your clinics every day, okay? Now, I need to know just one question. Among you, who has already done some chemical peels? Whether it's superficial, whether it's medium, whether it's deep, who among you already does chemical peels? Great. Is it mostly TCA or is it superficial peels? Superficial. Okay, great. All right. My name is Gorana Bijelic. I come from Serbia. Dermatology is my field, has been all my life. I have been working for this company, skintech Pharma Group, for almost 10 years now, and I traveled to more than 80 countries worldwide, and we talked about mesotherapy and chemical peels. Those are my two loves that we use and that we perform, and I will try to give you the idea why this company, skintech Pharma Group, why the chemical peels that I suggest, why are they 100% sure, and how to do them and to sleep good at night, because a lot of times when people say chemical peels, people get scared. I don't know if you remember this show, Sex and the City, when Samantha was doing a chemical peel. She's all red and she's wearing this mask over her face. You remember that? That's what people think that it will happen to them if they do a chemical peel. So we have to, A, use a good product, B, know exactly what we did, and C, deliver a perfect skin for them, because there's absolutely no treatment that can be so good for the skin, for the neck, for the décolletage, that a chemical peel is. Why? Because it takes the first layer completely off, and then your skin rebuilds itself, and the younger skin always looks better than the older skin, right? Okay, so the whole idea is this. The skintech philosophy is what I like to call it. This company, skintech Pharma Group, has been on the market more than 30 years. They have been doing chemical peels. They never changed the solutions, the formulas that they made. They just made new ones. So the old ones were the old ones, like 30 years old chemical peels, we still use till this day, and we have a very excellent results. What is it interesting? Definitely 80 countries around the world where we have distributors everywhere. And why skintech? Why not some other company? And this is the reason. Predictable result. I will teach you today, when you do this amount of acid, this amount of base, that many coats, this is the result. There's no way around it. It's not like this skin or that skin, neck or face. Or I will teach you today that if you play by the book, I will 100% sure give you what you can get for a result. In a chemical peels, that's amazing. Why? Because when you do fillers, for example, and you leave a bolus somewhere, you know exactly what you did. When you do a chemical peel, it's like with toxin. You inject the patient, but you actually wait for them to come back to see the result. So that's why today we need to learn what amount, how to do it, and what can we expect as a result. And every skin will show you that, okay? So predictable result. They have a full range of peelings. So that means you can go from superficial to medium peelings to the phenol, which is a deep feel. Patented technology, education all the time. I'll show you at the end of my slides. Their education is called Medinet. You can always write to them. They will accept you as a doctor. They sometimes ask for your license. but Skintech Pharma Group has their own site. It's called Medinet. You should really try this because most of the presentation, everything that all of the calls are doing around the world, everything is there. So you can actually teach a lot of new things. I'll make sure you take a picture of that slide. But when somebody asks you why chemical peels, when would you suggest your patient to do a chemical peel? What is the first and most interesting thing? Photoaging. Sun is now different than it used to be. Most of us have some hyperpigmentations. So that's most important thing is a photoaging. Then acnes, that's another indication for peelings. Wrinkles, when we're talking about superficial peels, they really don't work on wrinkles. But the medium peels or the deeper peels, they can actually work on wrinkles just fine. Pigment disorders like melasmas and even stretch marks. What do you think out of those things, what do we do the most? I'd like for you guys to think of me as your friend, as your colleague. And the more we talk, the more we communicate with each other, the more freely you would feel to ask me, because it's always good to have a person that you can ask if that person has 15 years of experience, tried every peeling there is on the market. So you'll actually learn more instead of just listening to me. What do you think that we use it, from all these things, what do you think we use it the most for? Acne. Photoaging. Is it a ladies or men? Ladies. Have you ever seen a man with melasma? Yes. Rarely, but yes. Have you seen the man with chlasma? No, because he cannot get pregnant. But usually, due to the estrogen and due to the hormones that we have, more ladies have these hyperpigmentations, melasmas, cholasmas, poikiloderma, civate, and everything else. It's more with ladies, less with men. But in my office, out of all these things, the most that I do chemical peels for is the beauty treatment. She has no melasma, no chlasma, no acnes, no hyperpigmentation, nothing. She does it every year for the beauty treatments. Think about it. If you have a lot of dead skin, stratum corneum on your face, none of your creams can go inside. Whatever you put actually stays on your face. So they like to do it just for the beauty of it. Your skin gets a glow, and a lot of people, I like to do it in October, November, December when it's a bit colder. I don't do it in the summertime. But as soon as it gets a little colder, they go, oh, I have to do a chemical peel just to clean my skin. It looks much better. So all these indications, and plus the anti-aging moment where they clean their skin because the skin looks better. And we'll show today why. What is the benefit? Once you do the destruction of the specific skin layers, right? There's something in our book is called epidermolysis, right? What happens? Well, I'll teach you today epiderm, derm, and hypoderm. I know you all guys remember this from your colleges, but we'll just go through it a little deeper today. So when you completely remove your epiderm from your skin, your basal membrane, your keratinocyte, has to produce new ones. Now think about it. This stratum corneum on my face is probably 2-3 days old. If I completely move it and my keratinocytes are brand new, of course they're going to look better. They'll have more water in them than the old ones, that stratum corneum, which are practically dead, right? So that's one of the most important things, the destruction of the specific skin layers, all right? Stimulation of the epidermal growth that happens in basal membrane, and then the inflammatory that happens inside, which creates new collagen. How do we do this? Who helps us? It's called a peeling agent. We'll talk a lot about that today, a lot about peeling agents. We also need to talk about concentration and the pH of that agent, peeling depth, patient, whether he is the regular skin type for our peeling or not, application technique, and then the preparation before the peeling and after the peeling. This is maybe the most important slide today. Peeling agents, I will teach you superficial peels like alpha hydroxy peels, TCA for the medium peels, phenol for the deeper peels, but also I will teach you concentration and pH. Why? If you have, for example, TCA, or even better, let's not go into the TCA. Let's take alpha hydroxy peel, what they call fruity acids, right? Alpha hydroxy. Let's take glycol acid. Do you know that it's normal that most of the creams have 10–15% of glycol acid in the creams? Like, for example, the company called Bioderma, they make some cream for the nights called the night peel. 15% of the glycine inside, okay? Will that make you peel? That cream, will it make you peel? No, 15% is low. But for example, our peeling, superficial peel, has 35% of that. Will that make you peel? Very slightly. But if the concentration is 70, will that make you peel? Yes. So you have to think about the concentration, the number that comes, that's written on a box. Another thing that's very important, the concentration is not enough. Why? The pH is the determination point. If the pH is high, 8, 9 or something, then that acid is not very strong. If the pH is low, 3, 4 or something, that acid is low, is strong, it's potent. I'll give you an explanation that you can relate to. Our TCA that I will teach you today, medium peel, and that really peels like a potato, like a young potato. So our TCA is 15%, and the pH is around 3.1, 3.2, okay? And it will make you seriously peel. Have you heard in the market something called PRX 30 or 33 or whatever? Their TCA is 33%, but their pH is high. It's 8 or 9, and it will not make you peel. Doesn't matter that the concentrations are twice the number, okay? So every time that you have a box, and I'll show you upstairs when we go, box of acid, you packed inside, two things are important. What is the concentration? And pH, is it high or low? Okay? That's extremely important. Then peeling depth. I want to show you that on a special slide. Then also the peeling type. Skintech Pharma Group has shown that TCA can be done from Fitzpatrick 1 to Fitzpatrick 4. Sometimes even Fitzpatrick 5. What I know for sure, deeper peels like phenol, Fitzpatrick 1, maybe Fitzpatrick 2. Everything else will be visible. What is that telling me? If I have a patient who's Fitzpatrick 4, deep wrinkles here on the barcode, I will definitely not do phenol for him. That would be my mistake. Okay? So Fitzpatrick 1, Fitzpatrick 2, Fitzpatrick 3, that's for the peelings, that's the perfect kind. Everything else, what you can cause is some hypopigmentations, which are then again problem to be solved, okay? So Fitzpatrick 5 and 6, you have to really, really be aware of, okay? Application and technique, we'll study that today. And we'll also talk about to prepare the skin and what are the post-skin treatments. Let's start from the beginning. The agents. Alpha hydroxy, salicic, TCA, phenol, and then what they call an adjuvant agents like kojic, phytic, retinol, ascorbic, thiotic, a lot of different agents. Superficial peels are usually used and done with what they call alpha hydroxy acids. They are very rarely by themselves, one acid. Very rarely you will see only, in my company, in skintech Pharma Group, very rarely you will see only the glyco acid, okay? They, as you will see today, they pack it in like a hybrid peel, that's what they call. They put a little bit of kojic, a little bit of retinol, little bit of alpha hydroxy, for example, glycol, little bit of salicic acid. You know, it's a combination of more acid inside one peel. Why is it so? I'll tell you why. For example, this salicic acid, and most of us know this, we give that to our patients when they have acne, right? Why? Because it eats the keratin of our skin. It's keratolytic. That's the name of that acid. So it gets there and it eats stratum corneum, all right? So when I have my acid and stratum corneum is eaten, my alpha hydroxy acid, even lower concentration, can penetrate deeper, okay? Then why do we have added kojic or phytic inside? Kojic, phytic, most of those are whitening agents. A lot of people are doing peelings so they can be a little whiter in their face, all right? That's why they make these combinations. And I will show you today in our peeling that they mix it all together. TCA, that's for the medium peels, concentration of 15%, phenol for the deep peels. So this is what we say. Superficial peels only go to the basal membrane. Basically, only epidermis. You see? Very rarely they go anywhere else. Medium peels come all the way to the border, and they go sometimes a little bit deeper, and then the deep peels go into the papillary dermis. When you're in reticular dermis, and your skin will show that, you will make a scar. So this is important to know, that if your goal is just for the acne, to clean the skin, you can stay superficial. If you want rebirth of the skin, you have to go medium. If you have some acne or some deep wrinkles, then you go deep. Is that okay? Depending on what you want to achieve, superficial peel will very rarely have some mild discrimination. Medium peel will peel, and the deep peel takes some time at home. Okay? This slide is not easy, but is actually everything you need to know about chemical peels. Dr. Depre, the owner of this company, made this slide to show you what can you get when you peel. Superficial peels, look, very secure, very secure, secure. Superficial peels, they stay in epidermis. Epidermis is 1 millimeter thick. Keratinocytes, layers of keratinocytes, and then what you see on the top is dead cells. All that is 1 millimeter. So superficial peels, they stay right here in this layer. The Grenz zone is where the basal membrane is. You touch that zone, and your body will form new cells. So I know that I have touched this zone with TCA, for example, because the superficial peel cannot really reach that level. So I know I touched that zone, and your skin will show this to me. You will see, I will teach you today. When, with the peeling, you achieve a point of something called frosting, white colors on the face, that means you have touched the Grant's zone. Do you know what a frosting is? Have you ever heard of frosting? Okay, I'll teach you this. I'll have a question for you. In the morning, when you want to make eggs, you break an egg, you put it on a hot oil, what happens? White. Protein, denaturation. Same thing happens in the skin. You take the peeling, the right concentration, and right everything. You put it on the skin. As soon as you put it on the skin and you see frostings, that means you touch the Grant zone, and that means your TCA has given you clinical view that all above that will asquamate, okay? Then you go a little bit deeper to the papillary and reticular. This is where phenol is. Everything after that is deep peel. But I think we should really focus on the superficial one and on the medial one, and phenol at this point. I don't mind showing you at all. But I think it should be something that you want to do in the future, because you have to really get really good at superficial and medial peels to know what to expect from your patient, and then do phenol. I hope you agree with me. All right. Sorry. When we are talking about peelings, we will start with 2 or 3 superficial peelings that I want you to know. Deoxyazolaic peeling. Look, everything is written on that box. They really, really, really try to make this really easy. First, the thing you have to see is the action of this peeling is in epidermis. Is it going to peel? Is your patient going to peel if the action is in epidermis, very superficially? No. All right? Then it's telling you what does it contain. Glycol, that's alpha hydroxy, a little bit of lactic, a little bit of azelaic, a little bit of citric. So it's a combination of different acids that are not really in high percentage, but it's a combination of different acids. Those two will give you the lightening effect, and those two will give you the rebirth effect for acne and everything. pH, as you see, is very low. It can be done on all skin types. I will show this peeling for you today, okay? One question. If alpha hydroxy peels go through superficial layer, do we need neutralization for them, and why? What do you think? Do we need to neutralize them, and why? We need to neutralize the acid, and I'll tell you why. Alpha hydroxy acid, they go through the skin. They go to the first layers, and if you don't neutralize them, they'll keep going, okay? They move through keratinocytes, they eat some desmosomes, just like if I was walking through your class right now, and I eat your desmosomes and I break the keratinocytes everywhere, and if I keep walking, that means you didn't neutralize me. If you neutralize me, I stop. That's why all these peels have little, they're usually called versicolor or something, they have little neutralization which is definitely not water, okay? Because the water makes the acid go deeper. A second superficial peel that I actually love a lot, also very superficial, but it has more acids and it's excellent for acne. Excellent for acne. Look, it has, where is, here, salicylic compound, so a little bit of salicylic, kojic and lactic for the lightening effect, glycol for the acne. So this solution is excellent for the kids, 15, 16. They will not peel. It's important for those kids that they know they will not peel because they don't want to go to high school and have a piece of skin moving from their face. And you can repeat it every 7 days, okay? This Easy Fitic, it's also a good product, but we usually use it on the body. Do you know what keratosis pilaris is? Keratosis pilaris, or when somebody has a really ruined elbows. So we use it on the body. It's a very soft product. Doesn't need no neutralization. It's a very soft product. Okay. Sorry. Now I want to tell you the real thing. Why are we here today? I just want to see something. Don't worry about it. Just a second. I moved it there. All right. Do you think that people in cosmetic can do chemical peel? Like cosmeticians, can they do chemical peels? Yes. The answer is yes. What chemical peel can they do? Superficial. That's the end of it. That's why we as a doctors, I don't mind you doing superficial peels. I think that's good. But us as a doctors, we should really focus on TCA and something that will give us apart from the cosmeticians. Because I don't know how is it in this country, in our country, we fight a lot with cosmeticians. I love them. I think they're very important. As a dermatology, I appreciate common expression, and I think they should really do that. But they sometimes go a little bit deeper in our field, so they also started doing Botox and lips and everything. And it's a big nightmare. We fight them all the time. Sometimes we win, sometimes they win, but they still do it. Why? Because when a person, your patient, believes in their cosmetician, she lets them do whatever they want because they are friends. She comes quite often. She's secure with her, and then they let her do crazy things. So superficial feels are okay. I invite you to do those, but make sure you know this TCA. Look at this. The TCA peel is basal layer and grand zone, which is telling me I'm not in epidermis anymore. I came deeper. Okay? So the phototypes are still 1 to 6, and the pH is low. I wouldn't do TCA to a phototype 5 or 6. I stop at 4. That's my practice. This is the distributor, but my practice is I stop at phototype 4. What do they have? They have acid and they have the base. And you're going to mix them together. They will write this much of acid and this much of base, and you mix them together, okay? And then you get 15% of TCA. Pay attention to this. This one is called Easy TCA. And this one is called easy TCA pain control. What is the difference? Completely same product. In this pain control, they have added very little bit of phenol, and it hurts much less. It's more comfortable treatment, and patients like it. In the beginning, I used to always buy the classic one, but I very rarely buy it now, because there's a huge difference in between the classic and the pain control. And there's a little change in the price. This one is little more expensive, but it's really worth it because your patient only feels the warmth and maybe a little tingling sensation, and with the classic one, it hurts. So if you think about which one to buy, always buy the pain control. All right, now, I'll go back to you and we will talk about some stronger peels than this, but we need to learn TCA first. And then after TCA, we can talk about all these other things. Cosmeceutical, phenol, anything you want, but let's learn this first, okay? We said exfoliation, so for the first one, first three layers, we just hit the basal membrane. What do you think it shows on the skin for the superficial peel? When something is superficial, what does our skin shows? You take some superficial peel, you put it on the skin, what does it show? Does it show anything? Erythema, thank you. Exactly. Look, when it's up to the basal membrane, when it's only red, then it didn't reach the basal membrane. If it starts being white, the frosting appears, then it's already Grant's zone, which means the red will not peel, and the frosting part over here and the frosting part over here will peel like this. That's why I'm telling you, when you're doing your peel, you know exactly what your patient will go through in the next few days. If you do the first coat and he says, I don't want to peel, and you just do the first coat and everything is just red, he's not going to peel. If you do the second coat and he becomes with the frosting, he's for sure going to peel like this. Okay? I want to show you something and then we go to this. How do we do this? In order to get your peel distributed evenly on the face, we teach you how to draw these lines to make 6 or 7 different areas. Why? Because I don't want you guys to take your peel, put it in your little sticks, right? Put them in the peeling and do like this to the face. Why? Because everywhere where the acid is, where it touches the skin, is going to be frosting, and everything else is going to be nothing. So I will teach you today, then when you work with peels, you take a little round dish that this company already prepared for you in the box. You take your sticks, you make a couple of circles around that dish, and you do area, and then you dip again. Another area, and then you dip again. Another area, and then you dip again, another area. So by that definition, you cannot go wrong, okay? So every time I take my sticks and I put them in the acid, I do one area. And not mildly, you do it with some force. Round movements. Okay? Then you dip it again, then you do the second area. Then you dip it again, then you do it. So this is called the first coat. Okay? Now, let's think about one thing. If the skin is oily and it's thick skin, what will happen in the first coat? Nothing. The answer is nothing. 100% sure nothing. So, if you want your peeling to work, make sure you do clean that skin thoroughly. Okay? Then again, if the skin is thick, now it's not oily, we cleaned it, it's just thick skin, and you do the first layer, what do you think the maximum of it can be? Maximum erythema. Now it happened to me because my skin is fairly thin. I was born like that. People are born with the skin type with the size of collagen in it. One coat for me, and I'm white as your board. Why? Thin skin, dry skin, very little bit of epidermis on it. It has eaten it all gone and came to dermis very close, very thin skins. So that's why you have to be very careful, and you have to do the coats like we just said here, one by one by one by one by one, and you finish. And this is not on time. You have no hurry. You put your sticks down and you're looking at the patient. TCA doesn't need neutralization. Superficial peels, they do, because they travel to keratinocyte. TCA goes down in the basal membrane, finds a protein in the cell, and shows you this. Frosting. And when TCA finds the protein down in the cell, it deneutralizes itself, so it doesn't work anymore, and your skin is white. Okay? So what I want to teach you today is you divide face in 7 areas. I'll teach you how to do that. And you do area by area with some energy, and you put your sticks down and you wait for a couple of minutes. What am I waiting for? Frosting. Edema very rarely in TCA. You get it. In fennel you get edema. In TCA very rarely. I'm waiting for a frosting. Thinner skins may give me frosting sometimes. Thick skins may not even give me redness. Okay? After my first coat, after my first coat is done, I look. Nothing happens to stratum corneum or erythema intraepidermal. If those two things are the cases, I apply another coat. Okay? My second coat looks like this. I divide faces in 3 areas, and I dip my sticks in the acid only 3 times. Okay? What could happen after the second coat? Frosting points, you will see today, small little points of white, or frosting cloud if it's a deeper peel. Does this make any sense? All right. Let's review one thing. If I have a wedding next week, what peeling would you give me? Superficial or medium? Superficial. I cannot peel. And I'll tell you one thing with TCA. The day that you do TCA, my patients usually come on Tuesday. Wednesday, Thursday, Friday, usually nothing happens. They're peeling off Saturday and Sunday. So it's a process. It's not just one day. Here, I put this acid, you go home, you peel in the morning, you go to work. No, 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 it doesn't work like that. They come, for example, on Tuesday, that's how I like them to come. Then they can put makeup and go to work Wednesday, Thursday, Friday. And then they start peeling Saturday and Sunday. Okay? That's how it works with TCA. So if I'm getting married next week, God forbid, if I'm getting married next week, there's absolutely no way you can give me medium peel. All right. What if I'm a child, and 15, 16 years old, I have a lot of comedones on my nose, acne on my face, superficial or medium? Superficial. You can do TCA on those kids, but what I notice is they get much better, but they don't come back to your office. Why? Because the kids in high school are horrible and they tease them and they don't want to do these treatments with you again. Okay? If your patient has melasma, superficial or deep or medium? Medium. There is no way the superficial peel can fix your melasma. Why? Because melasma is deeper. It's in the grand zone and in dermis. It's not, very rarely melasmas are epidermal. If they are, that's a very young melasma. If you want to get this melasma, medium peeling. Okay. If you're doing it for the beauty, for the anti-aging effect, superficial or medium? Medium. Superficial will not do anything. It will clean your face a little bit. You will be nice for the makeup, but to rebirth, to give you new cells, to look better, you have to go with medium. All right. If I'm doing superficial peel, do I neutralize or don't? Always neutralize. Superficial peel, go through keratinocytes. That's why it's called neutralization, the little tube inside. They eat keratinocytes, keratin cells, and they go deeper and deeper and deeper. You don't neutralize them, they can scar. I did phenols many times, and I never had problem. And I made a scar with the glycol acid, which is alpha-hydroxypeel. But it was 70% because my neutralization was empty. By the time I ran to the other office to get a new one, I already made a scar. So think about these things. And definitely cannot be water. Water makes the acid go deeper. Why am I saying this? After every peeling, superficial or medium or deep, you tell your patient, do not wash your face for 8 hours. Right? What do you use for neutralization? Yeah, the company packs you. In this company, it's a blue gel. I'll show you. They always have it ready. Okay? So, no water with acid. In the beginning, what you usually do, you clean their face very thoroughly and you start working with the acid while the face is wet. Doesn't go like that. Clean the face, completely dry, then you start working on your acid. And you tell your patient, no washing your face for 8 hours. Okay? When I have my TCA, do I neutralize or don't? Don't. Okay. Also, please, 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 pay a lot of attention. I will teach you today certain amount of acid and certain amount of base you put in that container. When you do that, make sure you check it twice, because once you mix this, that's it. Okay? It has been happening in the past that instead of putting 2 mLs of base and 0.7 mLs of acid, the doctor switched. And that gives you much deeper peel. How would you know? You start working and it goes toilet white. The frosting goes extremely white. So if you see something's really wrong with the frosting, stop immediately. Okay? You have to really be focused when you're mixing your acid and your base, because you're actually forming it by yourself. Why is that? They're putting this TCA in her concentration is 50% in those little boxes all by herself to last you longer. So you can have it this year and next year. If it's mixed together, then it dissolves quickly. So you wouldn't have it for the whole year. You probably had it for 2 or 3 patients that week, and then you would lose it. That's why they're keeping it separate. But you have to really think and double check. But once you mix it, once you make it, no neutralization. Then you do 1 coat in these 7 regions. You put your sticks down and you're looking at your patient. Is she white? Is she red? Is she any color? What's happening? Is there erythema? Is there nothing? Is there frosting? There's a whole science on frosting. I'm not going to bore with you today, but frosting can be with points. That's the most superficial one. Then it can be a cloud. Then when it goes to papillary dermis, when it reaches the blood vessels, because it breaks the blood vessels, then it can be a pink frosting. And then when it goes down to the reticular dermis, it can be a gray frosting. Gray frosting means scar. Okay? So there are different colors of frosting. In your practice, you will see the pinpoints or the clouds. Nothing further than that. Okay? Now, if I have a hyperpigmentation right here on my forehead, on my right-hand side, and I did 2nd coat, and I only have pinpoint frostings, will that solve my melasma? What do I have to do? Go over just her. So not the full face, not everything again, just, it's called mosaic peel. So you finish everything. And if you're not satisfied there with melasma, you can just go over that one place, okay? Very dry sticks, because it's already frosting. Very dry sticks, just repeat it a little more on that melasma, okay? Your patient, if I was your patient, and you did that to me, would leave the office with a black spot over here. Normal. Tell your patient, go home, don't shower, don't wash your face, use your makeup. Don't worry about it. 3 or 4 days, it will go away. But like 3rd layers, when you do, it gives brown or black spots. Normal, okay? What do we do after we reached a point that we like? Apply this post-peel cream. Also in your packed, everything is inside. You just need to apply it. You need to put it in the paste, or 1, 2, 3. Put it on a patient. It has a lot of growth factors inside, a lot of vitamins inside. So it's a major difference with this post-peel mask and without. I'll show you pictures. And there's a special way. How do you measure what kind of grams of this you can use? So I'll show that on theory, on the practical part. And these are the questions that we have to ask ourselves. What if something goes wrong? What should be done? And think about it. What can go wrong? Wrong dilution. They didn't dilute it properly. So 4 years ago, I'm in my office working with my patient, and a colleague of mine calls. She's from Albania. I know her, I like her, she's a nice girl. So she says, "Doctor, I called you, I'm in trouble." So said, okay, what can I do for you? She says, I over-peeled. Okay, how did you do it? I mixed it wrongly. Instead of 2 millimeters of base and 0.7 millimeters of acid, I did the other way around. I did 2 milliliters of acid and 0.7 of the base. And I said, okay, but did you notice something funny? And she says, yes. When I started working on her forehead, that same second, everything was white. And I said, okay, did you stop? She goes, no, I did the whole face. So yes, we were deeply in the trouble, and took us 3 or 4 weeks to heal that patient, because that's a strong acid. So if you make a mistake and you combine it differently, please stop, because it's easier to treat half of the forehead than completely whole face, okay? And it's normal. I've been in this field for 15 years, and we're just humans. And if you, till this day, have not made a mistake in aesthetic medicine, then you didn't work enough. Trust me, there's no other option. There's absolutely no other option. I've done sometimes for 12 hours straight and didn't make a mistake, and then I come for 3 patients and I made a mistake, because we are just people, we're tired, it's normal. Mistakes happen, doesn't matter. You need to stop as soon as you saw that you made a wrong delusion, stop, okay? Second thing, strong pre-peel conditioning. That brings me to one topic that I have to tell you. Will I peel the pregnant lady?
No.
Hell no. Will I peel if she's breastfeeding?
No.
Will I peel if she's using Roacutan? How do you say that? Yes. Will I peel her then? 6 months after the therapy, don't touch that patient. Okay? Will I peel if she has autoimmune disease like lupus, sclerodermia, morbus Crohn, ulcerosis colitis? Will I peel any of those acute autoimmune diseases? No. Okay? Will I peel if she has herpes? Well, I can. Not phenol, but everything else I can. Nothing will happen. But it's not smart. So, we are looking for the ladies who are healthy, okay? And men as well, because lately we do more men than ladies. Trust me, same thing will happen to you. So, can we say that in this room we have 25 people, and that for sure 23 are healthy? Can we say that? Right? Healthy, you know, maybe you have some gastroenteritis, sometimes, you know, problem with your back or some spine, but you're healthy. You're good enough for me to do chemical peel. Can we say that? Do you know that in this room, at least 10 people use retinols for their face, and that's going to make your peeling a nightmare? Doesn't matter that she's healthy. If she's using retinol, 1%, on her skin every day, she has no stratum corneum. She doesn't have most of your epidermis. Your one coat will be frosting all the way. That's why peelings are an amazing thing. They do wonders for your face. But make sure you prepare your patient, like tell him, okay, whatever retinol cream that you're using, whichever brand on this market, stop 7 days before the peel. Okay? Then you do the peel. Then she peels off, and the second you put the peeling on, the second that passes, she needs to start wearing SPF. And her SPF should be religious. She should wear it for 2-3 months at least. okay? So before the peel, you can give her some creams or not. Blending, bleaching, we sometimes give for melasmas. They're good creams to prepare your skin. But definitely tell her not to use retinol. Then you do the peel, and after the peel, she has to use SPF. I prefer 50, but there, for whatever reason, they like this 30. Whatever that is that you can actually make them use, okay? So that's why these things are important. Strong pre-peel conditions. I like retinol. I use 1%. Well, out of all the companies that I tried in this world, SkinCeuticals show me the best result. If now I'm your patient and I sit on the table, one coat will be so strong of a frosting that I will peel horribly, okay? Always, always, always. You should have a chart and you should ask your patient, pregnant or not pregnant, autoimmune diseases, any allergies, and then after allergies, the first question should be, what kind of creams do you use? Do they have retinol inside? Sorry. So I switched over a part, and I will go back just to tell you. There was a research that skintech pharma group company did. 12 different doctors, 6 different countries, 55 different reports, and it was on this easy TCA. What can we expect from one peel? So basically, they all read the chart, they all signed that they want to participate in this study. Before, as I told you, before, the preparation for the skin was this. So they gave them a clearance in the morning, blending, bleaching, and then Mela Block, and they used this R cleanser for the skin. So this is how they prepare the skin before, and then they use this to wash the skin. All the countries did the same thing. And they did the TCA in the uniform way, like we spoke today. And these were the results. So erythema, which is normal, is in 12%. Frosting happened to 80% of the skin. Pink and white, if somebody went deeper, that was 60%. This was reported for 2 coats. 3 and 4 coats we reported only on melasma areas. Okay? Easy TCA, generally the skin condition was 42% better, and the skin texture was 60% better, but also the pore visibility was 44% better. The pore visibility is something that actually drives your patient to you. They very rarely say, I need something for this or that, but they come and they're really precise. When they have oily, thick skin, they come and say, look at my pores, those are holes. And they're really interested in chemical peels because that honestly helps the best. Skin turgor also got improved. Okay, I'm not going to bother you with the Glogau, although the overall satisfaction was more than 90%, which with the chemical peels, you usually get a very high satisfaction rate. The only problem is those few days when they peel, but that's normal. These are before and afters. Lightening structure, the skin is just lighter, the hyperpigmentations are less visible. They're still present. You cannot get it. This is only after 1 treatment. They're still present, but the skin looks healthier. If you want to do it for the acne, you have to involve also the purifying gel, and this actually cleansing solution is amazing because it's good. It keeps the pH 5.5, doesn't change the pH. So if you want things done for your acne with the TCA, with the peelings that we are using, you also have to use the purifying gel. in order to get the best results. And for the melasmas and hyperpigmentation, we always suggest blending bleaching and SPF. Those are 2 creams. I'll show you upstairs how they look. Also acne's purifying gel, because the purifying gel itself has salicylic acid inside and it helps you through the treatment. But you can see all the skin colors are a bit lighter. Okay, this is the deeper peel. All right, before we go into the deeper peel, we have to talk a little bit about TCA a little bit more. So, when I'm not doing chemical peel to a patient, tell me. Nobody? Sure. When can we not do the chemical peel to the patient? When we just say, sorry, you're not for us. For example, for the... That's a good idea. That's a good idea. I like that. Maybe if she believes that out of 1 peeling, she can take the melasma off completely, which is not possible. When else? What is my contraindication? Pregnancy, breastfeeding, autoimmune disease. Sure. Retinoids, right? Okay. So I speak to my patient, we say, we will do it we usually start the chemical peels in October. I don't know how is weather here, but it's usually sunny in September, so we start our peelings in October. So when they call to schedule the appointment, my assistant tells them, please stop using all your creams with retinol before you come to this, blah, 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 blah. So when they are scheduling the treatment, you already tell them not to use the creams. Okay. So, for example, they came, and the day is Tuesday. On Tuesday, we do what to the skin? We first thoroughly clean the skin. We divide it in 7 areas. We dip it every area, and then we wait for the frosting. If there's no frosting, we do the second coat. Okay? Is that fine? Good. If we saw something a little bit red, she will not peel. If we saw pinpoints, she will peel, but it will look like she came from the summer. You know when the skin, when you come from the sun, desquamates, a very tiny little desquamations, okay? If there's a big mark, like a black mark on it, so we went 3 or 4 coats on top of it, that will all disrupt by itself and fall down. So they say, they come like this and they go, piece of skin, okay? All right. That's the topic I want to talk to you about. They cannot peel the skin with their hands by pulling it off. The young skin underneath is not ready to come out. It will fall off when it's ready to be fallen off. Don't push it and don't peel it with your hands, okay? That can cause redness, that can cause infection, that can cause many things. So what do we tell them? It's Tuesday today. We did our peeling. You go home and do not wash your face. If you feel stinging sensation or something that is like a little bit red on your face, which sometimes can happen, you can sell some product to them. It's called IPLA's mask, also made by SkinTech Pharma Group. That mask is very similar to the post-peel cream that you put on top of them, okay? So if she feels anything, you can sell her that mask, or we sometimes say use Panthenol, the cream, but a lot of people like to buy that mask because the mask is really nice for the face, okay? So next morning she wakes up, she washes her face normally, she puts her makeup and she goes to work. On day 3, so Tuesday, Wednesday, Thursday, Friday morning, or sometimes Saturday morning, when she wakes up, she can use a very strong towel, and with the circular movements, she can remove some of the parts, but not this, okay? Don't peel it off and leave it everywhere, but with a strong towel, you can wash it off. Whatever comes off, came off. Then you put another cream, some Panthenol or IPLA's, whatever you want, and then if she wants, she puts her makeup and she goes, okay? So no pulling off, deal? Okay. When can she start using the retinol again? 2 weeks after the peeling. Because a lot of ladies will ask you that. Most of their creams now have it. 2 weeks after the peeling, she can start using retinol again. For how long should she use SPF after TCA? At least 2 months. At least 2 months. It would be perfect if you made her wear it all the time, but it's like, I don't know, it's very hard to talk to them. And especially now with the stories that SPF is carcinogenic, and so it's hard to go through this today, but we try. But you know, you try to tell them. Sometimes they listen, sometimes they don't. Okay. If they have acne, do you combine chemical peel with antibiotics? Yes. Yes, inside and outside for the best results. Combine chemical peels with antibiotics. If she has acne, can she go to the cosmetician to clean her face, and at the same day, can she at the same day get the peeling? Yes. It will go deeper in the area. It will go deeper in the area, it will find the bacteria, it will kill the bacteria. No, TCA. Maybe sometimes I just do it 1 coat, but we do it frequently. I don't always do 2 coats, but 1 for sure. And you see very nice frostings where she went, because it goes deep all the way to the sebum. So can you do it? Yes. Also another question for you. Can we do mesotherapy and chemical peel in the same session? Yes. Yes. The only thing is, you first inject and then you peel. Because if you peel first, the pH of the skin will change and your cocktail wouldn't work so good. So yes, trust me, we do it in the office every day. All my mesotherapies that I do have some sort of peeling at the end. Sometimes when the weather is so nice, it's very superficial. When the weather goes bad, it's mesotherapy plus the chemical peel. And gives me the best result, because by the time your mesotherapy cocktails gets the water and makes your skin nice, by the time you peel and you have this uniform. So, but always inject first, you put anesthetic, you inject first, and then you peel at the end. Okay? I'll go to this in a second. Look at this chart. Look, if you have melasma, what do? Phototypes 1 to 3, phototypes 4 to 6. First peel, where did you get? To the grand zone. Second peel, where did you get? Is it worse? Is it stable? Is it better? If it's stable, like this, is it better? If it's worse? So this is a very nice chart to tell you what to do with melasma. Oh, no, but listen, that's what I want to show them. You see, this is the medii, the education of the skintech pharma group. So there, everything is online, like all the webinars that we do, and there's at least 10 of us, the calls, everything is there. So what you have to do is you send them a message and then they will ask your distributor, are you a doctor or not, in order to let you inside the group. And there's another thing here, which I suggest that people read for more information. It's the praise book about chemical peels, but also this is an extremely good group. We have had this group for 5 years, and on that group you can literally see, it's on Facebook. Yes, it also, the Pere will, he's the admin. He will approve you or not. That depends on your distributor, because they ask, is this a doctor? If it is a doctor, then it's okay. And on this group, I kid you not, you will love this group. You have everything that there is to know about chemical peels in the past 5 years. The questions, solutions, how many codes, and if there's a lot of people actually answering it, because I think there's like 500 or 600 of us, and then somebody will always answer if you have any questions. So it's a really good group. So look, we have 1,950 members. It grew since the last time I looked at it. Hmm?
3.3 thousand members.
Sure. No, we got big now. Because it's interesting, for example, in the beginning you have some questions like, I don't know, mainly your mistakes are that you do it when the skin is wet, or that you take those sticks and you don't dry them nicely, but you put it on the skin, and then here it's really red, and then you keep asking, what happened here? Why there's nothing is peeled, just there's a red dot here. So all these questions are there on the group, and people answered it. It's nice to read. It's better to read that than the newspapers today. Okay? All right. Are we going to have hands today for the practical part?
We will.
Hmm?
Yeah, we can do.
We can do hands?
Yeah.
Okay. All right. Let's start a little bit deeper peels now. Okay. From the deeper peels, today I will speak about only touch, and I will also speak about phenol. I will start with only touch. Why? Because that's also TCA. Okay? Just the percentage of TCA is higher, 43% of TCA. Okay? How deep is the peel? You see, it goes over here, papillary dermis to reticular dermis. So you have to be careful with this peel, goes deep. Phototypes 1 to 4, pH, as you see, is low. Where do we do this peel? On lentigo solaris, on the hands. Can it be done on the décolletage as well? Yes, it can. Do we suggest? Not so much. It's better to just do it for the hands. How do you do it? You apply directly with a small tip. You apply directly to the lentigo solaris, okay? How many times do you apply? Sometimes 5 or 6. Till you see a gray frosting. In order to get everything here uniform, on top of this, you apply just TCA, the regular 15% TCA, to make it look homogenic. Look at the frosting. Look at the color of the frosting. If it's more than 1 centimeter, then you have to do it 2 times. So you can't make big holes, okay? It has to be very small, very precise. And the before and afters are really good. What's the trouble with this peeling? You tell me now. No, not so many scars. You usually are really afraid of this peeling, so instead of 5 or 6 times, most of you put 3. So you under-deliver, but you then repeat it. But what's the biggest problem with this peel? Uniformization? No, you put TCA on top of it, makes it nice and uniform. What happens after the peel? What does she do?
She washes her hands.
Can she?
No.
It's a nightmare. I know I did it to myself. What you can actually do is take a little wet wipe and go like this, but all day without washing your hands, do you know how hard that is? It's a nightmare because you cannot wash it. This is a serious acid you put on that patient, and you can't wash your hands. You go to the bathroom, you can't wash your hands. It's horrible. But it really works. A lot of patients are motivated to do this. This is mainly what I want you to know about this peel. It says lentigo solaris. Something else? No. What does that mean? Do you know a lot of times on the skin you have BCC, basal cell carcinoma? Please don't touch this with acids. Refer them to your surgeon, have them removed. Also, seborrheic keratosis, if you do have radiofrequency, remove them. Don't touch them with the peeling because you don't know if nevus is not underneath it and you didn't check it with dermoscopy. So make sure that what you do is lentigo solaris. Don't put it on other things. I know some of us, after a certain period of years, you start getting brave. Oh, don't worry about it, it's just this, it's just that. You start getting brave, and when you start getting brave, you make mistakes, okay? Lentigo solaris, and that's it. Don't put it on different things. And this is something that we will talk now. Okay? All right. I just need to check something, and you will then play the other presentation for me, just to see something really, really, really quick. just example of what I was telling you today. This presentation is also on Medinet, my presentation, so you can see it there easily. Okay. I need one slide that I want to make sure that we understood. Okay, here we go. This is the slide that I want to talk about. Superficial peels, they come stratum corneum, somewhere in the dermis they finish. Medium peel, go to dermis. Even stronger concentration of TCA also finishes in dermis. Deep peels go from the dermis all the way to the hypodermis. Everything under reticular dermis, everything over the gray frosting will scar. Okay? All right. Can I see the other presentation, please?
This one?
Oh, not safety. The other one. Sorry. Don't have my glasses. That one. Thank you. All right. Did I kill you today? Huh? Sure? Everybody's really quiet. Are you hungry? Next time, instead of the water, we should serve wine. Da, definitely. Da. All right. So basically, this is an interesting topic. We can talk a little bit about it, but I assure you, till you have no serious experience in superficial and medium peels, it would not be smart for you to start doing deep peels because you don't know what to expect. You have to have some patients come back to you. You have to see how they peel. You have to know these things. They should be normal things for you. So before, I would think twice before I would do this phenol peel unless I had some strong background in the superficial and medium peels. We already saw this slide, and we said that the deep peels are those three right here. EasyFen Very Light, EasyFen Light, and lip and eyelid formula. The difference is in percentage of the phenol that's inside. Here you have 15%, 8, 15, and this is 60%. So that depends on the percentage of the phenol that you have inside of that solution. So right here, EasyFen Very Light, 15% of phenol, 8% of TCA, and it's in croton oil. I honestly love this peel. I do a lot of it, and I'll explain why. This EasyFen Very Light gives me a result that it is a little stronger than TCA, and it has more or less same desquamation process. It's more of a lightening effect. Why? Because phenol works on melanocytes. Less melanocytes, less pigmentation. So this I would strongly recommend, and it's also done the same way as TCA. So no. Sedation only for this lip and eyelid for the full face. For the full face. That's where you need sedation. But this one, it's done the same way as I will show you today TCA. I really like that peel. But the results are a bit better because the patient is drastically lighter.
And the pain compared to TCA pain control is the same?
Same, it's the same. When you have phenol, there's no pain. Phenol is anesthetic. This EasyFen Light, it's a serious peel. It has 30%. Downtime is 7 to 10 days. She will completely change her skin. You need to be advanced for this peel. And this lip and eyelid, it can be done only for the upper lip and lower lip. It can be done only for the eyes, and it can be done for the full face. Okay? And I'll show you what I mean. I like these slides because they put all the information that you need to know on one slide. They tell you, for example, the percentage of the acids. They tell you where the action is going to be happening. Grand zone, a little deeper papillary dermis. That's why the result is a little better than TCA. They tell you for the Gauguin scale, what can you choose. They also tell you in the praise scale, which region will you be, in which area will you be. They tell you indication, but they also tell you how to do it. Look, everything. 3 days before, 48 hours before is day 0, and then the next. How to prepare a solution, what to add, what to do after, how many layers to put. I like these slides. They really, they're know-how. They're actually from the Press book, and he put it all out. If you do, here, this Easy Fan Very Light, if you do 1 coat, then you don't need anything over that. If you do 2 or 3 coats, then you need to put bismuth soup gallate on top of their faces because of the bacterial infection. So 1 coat is okay, and they can live normal life. They will peel off the same way the TCA peels off. 1 coat. 2 or more coats, they have to use bismuth soup gallate. I think, instead of you taking pictures, I think it would be much better that I give my USB to your distributor and that you guys give him their mails, because sometimes it's very small for these letters to read. You won't be able to read it nicely. So the other presentation you can get off the Medinet, but this one I will literally give you. It's with my patients. Please don't show my patients to anybody else. I trust you won't. They're not really that pretty. But you can actually see it better if you had it on your screen instead of pictures. What I want to show you is this. Look at the change in the skin. This is 1 coat of Easy Fan Very Light. It's honestly a big change. She peeled. She was really red. Fennel gives you redness and edema. She was red for 2 days, like tomato red. She peeled strongly. It's not like with TCA. With TCA, you put a little bit of makeup and you go. With fennel, it gives you edema and redness. But the results, this is just after 1 peel. It takes me 2 or 3 TCA to reach this good result. Easy Fan Very Light, I told you it's a serious procedure. We usually do it in the ER. You look at her face. So it's a serious procedure. She needs to be shepherded at home. She cannot see for a day or 2, her eyes shut.
Easy Fan Light, this one?
Easy Fan Light, 30%. 30% of fennel inside. And we did full face. And the problem with full faces, when it comes to fennel, is it takes a lot of time. And I'll tell you why. Fennel is not toxic if you wait for it to be distributed. It goes through our lungs, it goes through our liver, and it needs time. So with the fennel of 30%, such a strong concentration, when you finish 1 region, you have to wait 15 minutes for your organism to use that fennel, and then you can go on the other side, So if it's just local, if you're doing, for example, just barcode, even with a stronger concentration, you're okay, because it's a small area. But if you're doing full face, it's a problem. Now imagine, we finished this side first. Now I wait for 15 minutes. Then this side, 7 regions like that. That's almost 2 hours. They get nervous. They get really red. They start to feel pain. You can give them some pill for the pain. And they get irritated by this bismuth soup galat because it's everywhere. But you have to put it there. But look at this. It's a huge difference in between this and this. Huge difference. My colleague Ordinovsky, I think you might actually know this guy because he's a trainer for stillage as well. He's a really nice guy. That was his patient. He brought it to the clinic. We did it, and he followed her up, and he made me this before and after. But it completely changes the skin of her face. Okay? Oh, it's okay. I'll give you, yeah. I will give you the presentation, no problem. This one I can give you easily. Lip and eyelid, that's completely different topic. That's the strongest phenol that our company has. Sorry. The strongest phenol that our company has, it's a 60% phenol in 1% of the croton oil. Croton oil is there to put the phenol deeper. I strongly suggest lip and eyelid, but for localized area, like if you want to do the eyes or if you want to do just the lips, the barcodes. It's a small area, gives you excellent result, as I will show you now on these pictures. And it's actually stronger than CO2 laser. Trust me, I had patients, and I'm also a patient of a CO2 laser, I like those, but it gives me better results. It just needs to be localized. And the person needs to be healthy. So it gives you how it's done. I'll show this to you today if you want. Preparation before and after, but look at the result. This is the result with just the toxin and phenol, no filler. Look how the lip contracts. Because here, the barcodes that we have done, when completely changed the structure of the skin and the tissue contracted. Look at her lip position, here and here, with no filler added. Just toxin. Toxin, it's always good to do toxin 7 days before the phenol, so the muscle relaxes itself. And then you do the toxin, then you do phenol, because you can go into the deep little pores. How does the process look? She comes like this. She tried everything. She tried the filler, she tried toxin. It stood there for 6 months. After that, she wasn't happy. Then she comes to me, and then I do toxin first. After 7 days, we do phenol, as you will see today. Very small amounts. As soon as you do it, the frosting is going to be gray. You'll see really strong frosting. In the same day, I put this occlusion on my patient. It's mandatory for not to allow phenol to leave. I want it to go deeper. In order to get it deeper in this area, I have to occlude it. Okay? In the morning, when she comes, I will take the occlusion off. Everything is packed in the box of phenol. And I will put IPL cream. Look at the next morning. The cream and everything that we did, she's red and this hurts. She takes pill for the pain, edema, redness. Her lip is 3 times her size. She looks like this. That's normal. And after the post-peel cream, I put bismuth soup galat and I let her go home. Okay? Full 6 days she's using this bismuth soup galat. She cannot wash her face. She cannot sleep with the animals. it was easy when it was Corona time. That's when we did most of our chemical peels because people were wearing masks. And if she wants to go somewhere public, she needs to put a mask. It's not easy. And especially, it's not easy to talk because you have this crust all over your mouth and you basically talk like this. But look at before and after. Sure.
I have a question. So after you've done the peel, you don't put bismuth gallon on?
No. After you've done the peel, only in this area. You put the occlusion, you send her home. Tomorrow morning, she comes back, you take the occlusion off, you put the mask, then bismuth subgallat. 6 days, she wears bismuth subgallat, then she comes. On the day 7th, she washes her face completely, and she can put makeup. And she is red for months. 2 to 3 months, she's red. You know what my patients tell me? I love my new skin, but I hate that I'm a piggy skin. It's true. Her face here looks like a piggy skin. You know that little pinkish, but all that goes away. In the treatment, when I treat these area with lip and eyelid formula, I always treat the whole face with TCA 15%. Always, always, always. To make it uniform, okay? All right. I'm 3 minutes early. If you, we're on time?
Yeah, perfect.
Good. If you agree, we can let them relax a little bit. And then we can go to do some practical part.
Yeah, yeah. But first to do the photo.
Ah, photos first. Okay, okay, okay.